Today, we will be discussing the life and work of Aaron Beck, the creator of cognitive behavioral therapy. Aaron Beck was born on July 18, 1921. He was born in Providence, Rhode Island, to Russian Jewish immigrants. He was the youngest of three children with two older brothers. Throughout his childhood, Beck's mother struggled with depression. Before he was born, his parents lost two daughters, one to a miscarriage and another to the influenza epidemic. When Beck was 8 years old, he suffered a staph infection after breaking his arm. At this time, this kind of infection had a 95% mortality rate. After this event, he developed anxiety towards hospitals, blood, and everything else that related to his event. However, as he grew older, he exposed himself over and over again until he could stand the sight of blood without fainting. After high school, Beck attended Brown University, where he graduated from in 1942 with a degree in political science and English. After graduating from Brown with honors, he attended Yale Medical School, where he first enrolled with a degree in neurology. However, during his training, the chief of neuropsychiatry required all neurology students to take a 6-month rotation through psychiatry. After his 6-month rotation through psychiatry was over, Beck decided to stay in psychiatry because of strong peer influence as well as his own unanswered questions about the realities of psychoanalysis. He also felt that psychiatry had more successful treatments to offer patients with mental illness than neurology did. After Beck's residency, he spent 2 years as a fellow at the Austin Riggs Center, a psychiatry hospital in Stockbridge, Massachusetts. After practicing on his own for a while, he joined the Department of Psychiatry at the University of Pennsylvania in 1954. Here, he taught, conducted research, and saw his own patients. He is still currently employed as a University of Professor Emeritus of Psychiatry, despite being 96 years old. When asked about his age in a recent interview, he said that he did not think his age mattered as far as his career went. He still had goals and things to discover. Beck is the creator of cognitive behavioral therapy. He created this method when he realized that many of his patients had negative thoughts which clouded their minds about the environment around them. Although this therapy was first used on patients with disorders such as depression or anxiety, it now has grown to encompass a wide range of people, cultures, and disorders. Beck believed that negative thoughts block out positive thoughts, which create warped interactions. He calls these warped interactions of the environment around them distortions. He seeks to correct thoughts into more realistic views and positive channels. An example for this is one day a patient came to Beck convinced that his wife was ready to leave him. When asked to explain what instance made the patient realize that his wife was ready to leave him, the patient replied that his wife had forgotten to kiss him goodbye that morning. Examining the scenario further, the patient and Beck came to the conclusion that the patient's wife was not ready to leave him, but had just been busy getting the kids off to school and had forgotten to kiss him goodbye. Aside from creating cognitive behavioral therapy, Beck has created a number of measurement tools, including the following: Beck Depression Inventory, Beck Anxiety Inventory, Suicide Lethality Scale, the Fetus Attitude Scale, Hopelessness Scale, Obsessive Compulsive Scale, and the Panic Belief Questionnaire. One of Beck's earlier works is the Hopelessness Scale, and along with this came the Suicide Lethality Scale. Beck realized that there were 3 categories of people talking about suicide. The first category were drug dealers, people that thought about suicide, and these people may even have a plan on how to act on suicide. Their second category is the attempters, people who attempt suicide but do not have a successful attempt. Finally, the third category in suicide is completers, people who have successfully completed a suicide attempt. The suicide lethality scale aids to help individuals establish where patients are at and as well as establish what kind of outside help they are going to need. The current applications regarding cognitive behavioral therapy are endless. Below are 3 research studies that have used CBT successfully. The first study involves body image and self-care in men afflicted by HIV and sexual minorities. In this study, the researchers found a positive significant change in body image and also self-care hygiene in these men. The second study used cognitive behavioral therapy for victims of PTSD from Hurricane Sandy. In this study, patients were given 8 to 12 sessions of cognitive behavioral therapy 9 to 24 months after Hurricane Sandy. They also found a significant positive effect in helping alleviate symptoms of PTSD, no matter when the therapy was given, either 9 months after Hurricane Sandy or up to 24 months after Hurricane Sandy. Lastly, there's research in using cognitive behavioral therapy in conjunction with medication for schizophrenic symptoms. Cognitive behavioral therapy, along with routine care and medication, was found to have a positive, significant effect in alleviating both the positive and the negative symptoms. However, cognitive behavioral therapy is not suggested as a substitute for medicine, but it is seen very helpful when used in conjunction with alleviating the symptoms of schizophrenia. Currently, Beck lives in Philadelphia with his wife Phyllis Beck, who is a judge in the state. They have lived here for several decades. Together, they have 4 children: Roy, Judy, Dan, and Alice. Their oldest daughter, Dr. T Beck, is a leader in the field of cognitive behavioral therapy and is the director and president of the nonprofit Beck Association for Cognitive Therapy and Research. Their son, Roy, is a neuro-ophthalmologist. Their son, Daniel, is a cognitive behavioral therapist in Boston. And their youngest daughter, Alice, is a lawyer and a professor at a local university following her mother's footsteps. Aaron Beck is 96 years old, and cognitive behavioral therapy has been around for a while. However, new applications are being discovered. The positive, powerful thing about cognitive behavioral therapy is the long-term effects of a short-term therapy.